The lab is very essential for veterinarians because, for one, we can't talk to our patients. We just have to know if they're ill or not based on our direct observation on the animals and with the lab results. Because you can't ask a dolphin, does your stomach hurt? Are you having shortness of breath? You can't ask the dolphins that. That's why the laboratory is very important, because it gives us a good picture of what's going on inside the animal without actually looking at the insides of the animal. There are evidences of an illness from blood samples, from fecal samples, and urine samples if we have it. And it's important to have an in-house lab, because when you get the samples, you can process them right away. And the sooner that you get this information to the ones who are going to administer the treatment, the better. So in-house lab is very important for very quick decisions. In the marine park setting, usually when the animal starts to refuse food or refuses to approach a marine mammal specialist, because the normal behavior of a dolphin, once the marine mammal specialists are there with their buckets, they would come near and then, bob their heads up and down and wait to be fed. But if that's not seen, that's one sign that something is going wrong. Or sometimes if you actually just stand there and listen to their breaths, that's usually what I do. Sometimes I just stand there and listen to their breaths, because the more you hear the normal ones, the better for you to be able to spot the abnormal ones. So it should be like a clean inhale exhale. But if there's a stop between the inhale and the exhale, or there's some sort of like wheeze, or sometimes you can actually hear not the way we cough, but we call it the cough. If you hear that, then we start to suspect that something's going on.